So 25-year-old model Hailey Bieber recently made headlines when she revealed she was hospitalized after developing a blood clot that traveled to her brain.
Well, her story sparked conversations around what exactly causes blood clots, especially in young people. So here to break everything down and everything that you need to know about blood clots is Dr. Yoni Freedoff. Welcome back, Dr. Yoni.
Hi, it's nice to be here. Thank you.
So listen, Dr. Yoni, a lot of people don't know exactly what a blood clot is until, sadly, it maybe actually happens to them. So if you can break it down for us, what exactly is a blood clot?
Sure. So very simply, a blood clot is a collection of blood products. So it's platelets that stick together along with a plug of red blood cells, and it's all sort of tied together with this mesh of protein called fibrin. Now, blood clots can form in our bodies in a response to injury, and that's healthy and normal, helps to stop bleeding. But sometimes blood clots can form in non-injured blood vessels, at which point they can block blood flow, and that can lead to a whole host of different problems.
Okay, so how do you know that you have one if you have one? Like, what are the symptoms?
So the symptoms of a blood clot will really vary depending on where the clot is located. So two of the most common locations and concerning locations for blood clots would be in our legs' deep veins and in our lungs. When we have a blood clot in our legs' deep veins, that's called a DVT, or a deep vein thrombosis. And the symptoms you might experience would be swelling in a leg along with warmth and tenderness. Sometimes it happens in both legs, but usually in one. But if that clot dislodges from within your leg's deep vein, it can travel through your body's venous system and end up in your heart, where it can be pumped into your lungs. And then it passes through our ever-narrowing blood vessels in our lungs, where it can become lodged. And then it's called a pulmonary embolus. Pulmonary emboli are emergencies. And the most common presentation of a pulmonary embolus, although it's quite varied, but the most common one would be fairly sudden shortness of breath, along with sharp chest pain and cough.
Okay, so now we're good and scared. This is supposed to be informing us, but you've got two hypochondriacs here. How is this diagnosed then, doctor?
So with most diagnoses in medicine, there's a combination of history taking along with blood tests and medical imaging. So from a history taking perspective, we do something called the Wells score in the emergency department. It's named after actually a doctor from here in Ottawa who I've had the pleasure of working with, a guy named Phil Wells. And depending on how high you score on the Wells scale, along with blood tests called a D-dimer test, that tells us whether we should be doing an ultrasound to look for one of these deep vein blood clots. And the ultrasound, we can actually visualize it. With a pulmonary embolus, because it's a medical emergency, often people are quite unstable. And they'll have a whole host of different tests conducted by a bunch of different doctors, from emergency room docs to cardiologists, radiologists, and even sometimes intensive care physicians.
Mm-hmm. So what are the most common causes of a blood clot?
So the most common causes would be a prolonged period of being immobile. So if you're sick and lying in bed for a long time, or if you're on a very long plane ride or car ride, recent surgeries or traumas, cancer, pregnancy, oral contraceptive use, and high blood pressure.
Okay, so we started off this segment talking about Hailey Bieber, doctor, because it was a really high-profile case and story, and she ended up saying that it was COVID, travel, and birth control that were likely contributing factors that led to her blood clot. What's the takeaway that we can garner from her experience, and is there something that perhaps all women should know?
Well, so certainly from a COVID perspective, we know that even mild cases can increase the stickiness of our blood and increase the risk of blood clots. Why that's happening, we're not entirely sure. It may be because of the damage COVID is actually doing to our body's actual cells, or COVID may be interacting somehow with our blood clotting cascade pathway that leads to increasing our ability to have clots form in our blood. With respect to oral contraception, there is a slightly higher risk for women on certain types of oral contraception to have a stroke or to have a blood clot. The studies would suggest that the risk goes from 4.4 people per 100,000 without being on an oral birth control pill to 8.8 per 100,000 who are, which is a very slight increase in risk. A recent study, though, out of Sweden did not find that increased risk. But all this to say, different oral birth control pills confer different risks. And certainly one could speak to their family doctor about which pills they might be taking and whether there's an increase in risk therein.
What about the airplane part?
So the airplane part, certainly it's getting up. So once the plane's in the air and moving, every hour or two, getting up and walking around, what that can do is it can pump the blood out of our calves and up into our core and really, in a sense, stop the blood from pooling. Because as we know, when we cut ourselves, our blood is not moving anymore, and so it clots. And so the same thing would be potentially happening on these very long travels.
Well, I mean, and lots of people are traveling right now. People are, after 2 years, everybody's getting on a plane. So FYI, not to fearmonger or anything like that, but when you're on the plane, do some squats. But Dr. Yoni, Hailey Bieber, she's only 25 years old. So, a lot of the reason why this was so shocking is because we think when you're young, right, these things don't happen to you. So how common is it for a young person to get a blood clot?
Yeah, it's extremely uncommon for young women or young men or anybody to get a clot under the age of 25. Figure it's probably 10,000 times more likely for a person to get into a car accident than to have a clot at that young an age.
Interesting. Okay, so let's talk about stuff that empowers us a little bit, right? So what can we do to either prevent a blood clot or are there genetic factors that we need to keep in mind as well?
Yeah, so for prevention, it's the usual suspects. So it's doing the things to reduce our risk factors. Definitely don't smoke. Exercise regularly. If you are on a lengthy plane ride or car ride, breaking it up with some walks in between. And if you have high blood pressure, definitely ensuring that it's treated. With respect to genetics, absolutely. There are genetic causes of blood clots. And those we certainly can't do anything about, but we can still control our own risk factors.
Okay, so in the unfortunate event that you do have a blood clot, how is it treated?
So we treat blood clots with blood thinners. We want to really just dissolve the clot, so to speak. And so we use blood thinners, and then we will often keep people on blood thinners once the clot is dissolved to try to ensure that it doesn't return. Depending on the cause of the clot, people might actually need to be on those blood thinners for life. So for instance, with people who do have genetic clotting disorders, they may well need to be on these drugs for life. And very, very occasionally, depending on the location and the degree of the clot, sometimes we need to operate to actually remove the clot itself physically.
Wow, yeah, in that extreme case. Okay, so if someone does get a blood clot, are they more likely then to develop another one?
So absolutely. So anytime we develop any condition, we are in a sense showing that we have an ability to have that condition. So people who've had a blood clot are at a higher risk of having another blood clot. But what we try to do with people who have blood clots is to do very extensive investigations to try to determine if there's a genetic cause that we can identify, which helps to guide treatment. And would require, again, that treatment to be lifelong. But other times, if there's no genetic causes found and the blood clot, it resolves, once the treatment is completed, really it's just simply a matter of monitoring for recurrence of symptoms, but would not require lifelong blood thinners.
Okay, wow, very insightful and timely as well. Dr. Yoni, thanks so much for joining us.
Thank you.